The state of North Carolina is more than twice as long as the distance between London and Paris. From soaring mountains through the foothills, the Piedmont coastal plains, to the pristine beaches, there are hundreds of towns and cities, each with unique stories to tell.
There's a place where you can love your neighbors, you love yourself, and everybody can get along.
Every North Carolina community has pride, and more than a few have real challenges.
The nearest grocery store is 18-20 miles away.
Main Street NC is a special series from the WUNC Politics podcast, telling the stories of communities across North Carolina in the words of the people who live there and reported by Capitol Bureau Chief Colin Campbell. Main Street NC, coming up after this.
On a chilly Monday morning, B-Mocha Coffee Shop is one of the only businesses open in downtown Williamston.
Would you like your mocha sweet?
Yes, please.
Sweet and strong.
Sweet and strong, yeah.
See, Starbucks don't ask you that.
I know, right? Yeah, it's just always the same, right? Yeah. After Taiwan Edwards fixed me one of the strongest espresso drinks I've ever tasted, I was curious to hear how she and her husband Jeffrey opened the only coffee shop in all of Martin County. Turns out the couple is actually from Washington, D.C., They saw the Main Street building for rent when passing through this town of about 5,000 people, halfway between Raleigh and the Outer Banks. They thought it could be the perfect spot for a coffee shop.
We'd never heard of Williamston. You heard my husband? Yeah. We never. So to come here and to be what we consider as foreigners, they say, I don't know.
Yeah. Outsiders, not from the state, yeah.
And to get that much support, that's like, wow. So we gotta, we say when we open up, we gotta get back just because of the support.
They recently bought a larger space down the street and plan to expand the shop with sandwiches and lunch items. But while their business is growing, they've heard lots of concerns from their regulars about another community institution that sits empty for now. Martin General Hospital closed its doors in 2023.
See, we didn't know much about it, but we hear people like, that's how I knew the hospital was gone.
Yeah.
Yeah. And they was upset. Why are you going to take the hospital from once again, when you take stuff like that, or you're not willing to fight to keep something like that, now your children, their children, have to go to, Greenville?
Yeah, like Greenville or Washington, I guess, are the closest.
Yeah.
The shuttered hospital has meant much longer ambulance rides and big concerns about the state of health care in this rural county. But local leaders are hopeful the building could reopen soon as a smaller facility known as a rural emergency hospital. ECU Health, which operates hospitals in Greenville and smaller towns across eastern North Carolina, has developed a plan. Chief Operating Officer Brian Floyd says a new model could work in Williamston.
Just turning back on that hospital won't work. Just setting up emergency room there, it'll help, but it won't be sustainable. It won't really solve enough of the problem. But in the context of a system of care where ECU Health can leverage several locations, we think we can do the most good then. And so we've asked the state for $220 million in investments to help us build the new tower at Beaufort and build the rural emergency hospital there in Martin County. And by doing so, we can actually serve not just the Martin County area, but the surrounding areas in a more effective, efficient way.
Patients would be treated in an emergency room in Williamston and then transferred to larger hospitals like the one in Beaufort County for additional inpatient care. Floyd says the plan just needs funding from the legislature.
Martin County has more than 20,000 people there, and they have volunteer EMS systems and now no emergency service anywhere nearby, and so they're having a crisis of healthcare.
Leaders here are pursuing other projects to keep residents healthy, too. They're expanding a trail that connects the downtown to a boardwalk along the Roanoke River. The boardwalk happens to be the site of the town's original wharf, which once brought commerce up the river from the coast. The goal is to get residents and visitors outside to take a walk or paddle the river, and there's even a shelter for people looking to camp here. To hear more about the hospital's future and how it impacts the economic state of Williamston and Martin County more broadly, I stopped by the county office building to meet with the county manager. Drew Batts became the county manager for Martin County earlier this year. He previously worked in the manufacturing industry and grew up right here in Williamston. Thanks so much for speaking with me.
Yep, you're more than welcome. More than welcome.
So tell me a little bit about the history of Martin General Hospital and some of the factors that led up to its closing down in 2023.
So Martin General had been a long-standing hospital here in Martin County, and in the years leading up to the shutdown of Martin General, Quorum Health, who was managing the hospital at the time, had suffered millions in losses, and fairly abruptly decided to shutter the operations. If you went into the facility today, you would be able to tell that it's like the people walked out overnight and that was it. Like there's poster boards on the walls with different crews and celebrating different milestones and things like that. That it's almost a little bit leery. It's like you're walking back into the past that just happened yesterday, and it's been almost 2 years.
Yeah. So do you have any indication that was a danger of something that would happen with that hospital at that time, or?
I think leading up to it, in the short time there leading up to it, there had been indication, but it wasn't anything that would prepare you to be able to plan ahead.
Yeah, because I guess they had shut down some elements of it and kind of downsized a little bit.
Yeah, they were trimming the fat, I guess you would say.
Mm-hmm. It's somewhat unusual to have the county actually own the hospital facility, right? A lot of places it's not. It's a nonprofit or connected to a healthcare system that has the ownership.
That's more the standard now. I think years ago, I don't think it was as much out of the norm as it is now. It's not a normal activity now for a county to actually own the facility.
Yeah, does that pose some unique challenges with this one compared to some other town that maybe has a hospital that's closed down and they're trying to do the same thing that y'all are?
I'd probably say not so much. The one thing that it has allowed us to do as a county is we've been able to take the resources that we do have and start the process of trying to get this facility, I'd say, up to par for what we call the Rural Emergency Health Hospital, Rural Emergency Hospital. So we've actually been able to use some of our actual funds from the county to better get this hospital going in that direction, from certain types of upfits and things that we're having to do to modify the facility to better meet that criteria. We've been working on that for over a year now. Just trying to, whoever does come in, we're setting them up for success, we hope. So.
Yeah. So that sort of keeps the facility, up to shape, whereas if it was just completely abandoned for several years, you'd have a more uphill battle in getting it ready to reopen.
100%. The last thing we wanted to see is that it would sit empty and just be a deteriorating shell. We're trying to do everything we can to keep it in line to open back up.
What's been the impact of the closure on the broader healthcare access landscape for Martin County?
So the impacts are, they spread multiple different directions. We had the economic impact. Obviously the hospital here in the county, it provided a source of income for many, and most of those employees lived right here in Martin County. That also relates to the generation of funds back into the local economy. And so we've suffered on that end, and we're also suffering on the EMS end. So our EMS facility, in this county are facilitated through volunteers. So we have multiple satellite EMS offices that are volunteer-based, and the county has always provided some type of a stipend to these different groups to allow them to operate in Martin County. But we are now providing upwards of almost $1.5 million a year to help support the EMS services due to the wear and tear on the vehicles. We're having to go 20 minutes one way towards Bertie's small hospital there if we have emergency, or we have to go towards Beaufort County, which is almost 30 minutes from any given point in the county, and Pitt County obviously is about 30 miles. So it's a lot more wear and tear, a lot more upkeep on the vehicles, and it's just a burden on the staff as well. It's quite a bit more on the road than it was before. Having a local hospital within 10 miles just about of any given point in the county to 20 miles at best.
Yeah, does that sort of create an issue for response times if you have units that are out of service because they're having to travel out of the county to transport patients as opposed to keeping everything within the county boundaries?
So it has, and obviously it will affect the response times, but I will say that with the extra funding that we're providing, that is part of it, and these crews have gone above and beyond to limit the effect on their response times. I mean, they're doing everything they can to ensure that we are fairly prompt, and for EMS they are very prompt. We haven't One of the complaints that we rarely receive would be that the response time is not prompt. It's just the length of time it takes.
How long you're on board an ambulance before you're at the hospital.
That's 100% right. Yeah, that's the main complaint we get. Obviously, is that it's a good distance to any facility.
So that's sort of the biggest from a public safety standpoint of knowing that minutes are sometimes measured in lives lost in a medical emergency situation, whether it's somebody local or somebody who's just passing through on 64 and gets in a car accident of some kind.
That's right. And some services require paramedic type licensures or certifications, and that's something that we're naturally looking at now, is to figure out how can we get those services in Martin County. And it's expensive. I mean, everything you look at is just super expensive. So it's a burden on a Tier 1 county for sure. But it's something that we're going to need. So we have had other counties to help support us in some of that. If they're close to, like say, if we're close to Beaufort County or Pitt County, and somebody needs that type of treatment, they'll meet us at the county line or something like that to do that. So we will say we've had good partnerships from neighboring counties to help us out.
Has there been much of an impact on sort of outpatient care in terms of people having access to specialists that were sort of in some way connected to the hospital, and now those folks are seeing patients in one of the other surrounding counties? Yeah,
I would say, it's obviously the same. It's causing, more up and down the road. People are having to travel farther to specialty type services, and that may not be the highest impacted area of the closure, but it is definitely a fairly high impact. People can't go see orthopedics here in town. We have to go out of the county or out of the town to see orthopedics in most cases, and surgeries for sure. You're not going to have any local surgeries here in Martin County anymore.
Have you seen an impact on Martin County's overall economy? I'm just sort of curious if it's harder when your economic development team is talking to potential employers that are looking at putting a facility here, if that makes a recruiting challenge to not have that healthcare infrastructure that you would have had a few years ago.
Yeah, so this is something that I'm a little bit more aware of. In my position, we're working with ECU Health from the health side, and leaning on those guys for their knowledge, their expertise. But from the economic development standpoint, it's making it really tough to approach and encourage bigger businesses, more substantial corporations to come to Martin County. Just, one of the first questions you get is, what type of healthcare systems do you have? These big employers, when they're trying to encourage people to come to work at a facility, the people are going to look for healthcare. So it's a natural deterrent to larger companies coming into this area. And it also has affected the companies that exist here. We have a couple car dealerships in town. Every one of them have reported sales losses since the hospital shut down, and you'd be surprised at just how big those losses are. I'm not going to direct quote any, but I've heard a few in the past couple of months, and it's like, I never had any idea that the 200 or so employees I believe that Martin General probably employed would have put that much money back in our economy.
Yeah, so it's sort of this residual effect, whether it's a restaurant across the street that did a really good lunch business 5 years ago, or a car dealership that is right down the street that everyone sees when they're coming to work.
Yep, exactly.
Well, where do things stand now with the efforts to reopen the emergency room component of the hospital?
So at the end of July, we went into a letter of intent with ECU Health, and we're still working with those guys weekly on the path forward. We're trying to get there. Right now, there's an ask for a fairly large sum of money to not only open Martin General back up as a rural health center, but there's money in that pot for Beaufort Health as well, to add over 101 beds to their tower, another tower with 101 beds, to allow more of a regional healthcare type situation where people that come to the rural emergency health clinic here will be able to go, if they need further services, they will be able to transfer to like a Beaufort as a more immediate care type facility. But we can triage them and address the emergent type situations right here in Martin County. So the standstill right now is money. We're trying to get the funding for the hospital.
Is that something that would need to come from the state level? I assume the county budget, there's only so much you can do with that kind of a...
Yeah, it's a substantial amount of money. And, you're talking about a Tier 1 county that works off of a $42 million per year budget. And you're talking over $200 million. $200 million is the ask currently to try to get that regional health system put together.
Yeah, so it's sort of waiting on, I guess, the legislature is interested in doing it, but obviously there's currently no state budget and all of that needs to get worked out in the process of getting funding for this and I'm sure lots of other projects as well.
That's right. Yep. So ECU Health has taken the lead on trying to work with legislators. We've met multiple times now with different representatives from the area and different legislators to make sure that they understand the situation and that, you know, the need is heavy here. We've got over 20,000 people in Martin County and no hospital. So, I mean, there's definitely a very local need for this hospital. But Martin General served multiple counties, you know, when it was in operations.
And I imagine you mentioned the proponent of this is adding more to the Beaufort County Hospital, but I assume there's been sort of a strain on surrounding counties that are having to take care of more patients than they did a few years ago.
Oh, yeah, absolutely. So the emergency room in Bertie County and Beaufort County, especially, you know, upon closure of Martin General, they were inundated with emergency room visits and things like that, just simply taking the load from Martin County and dispersing it by two different facilities that were already very busy facilities.
Yeah, so what is a rural emergency hospital and sort of how does it function differently from what you would have seen at this hospital a few years ago prior to the closure?
It's definitely going to be on a smaller scale. You will have no overnight type stays. It's going to be outpatient services only. So what will happen is people come to the rural center and they get triaged in like an emergency type situation, emergency room type situation. You get triaged, and at that point, you're either going home or you're going to a different facility if you've got to stay over, 24 hours. And it will also hopefully offer outpatient type services too. So any surgeries that can be done without an overnight stay or a 24-hour stay, hopefully we can offer some of that at that hospital. So that won't vary much from what Martin General already had going on in that situation. But the biggest difference would be that it's not made for 24-hour stays.
Is there concern at all as far as the national and state policy issues around Medicaid as to how this affects the economics of getting this off the ground? Is there sort of some uncertainties involved with Medicaid funding right now that makes this a little bit more difficult than it might have been if things were a little bit more stable on that front? Yeah,
I think just the insecurity in knowing which way Medicaid is going to go, it obviously provides some more insecurities in the sureties of this situation. But the overall, I don't know that it impacts it quite as much as you might think. I mean, there's still going to be a need here, whether we have Medicaid in the way that we want it or in a different capacity. There's still a need for health care here, and I feel like the legislature and General Assembly help us address it.
Is there a time element to how quickly this gets done? I'm curious if it's easier to sort of reopen the facility sooner if you get the funding rather than if it had to wait several years before the necessary funding came through, if it becomes a more difficult project to get up and running.
So naturally, the sooner the better for anything like that. But I don't know specifically how it will affect us if we go years. We're not planning, to go years. Hopefully, the sooner the better. I would say we're not. I guess the easiest way to answer that question is we're not planning for it to go years. But I don't know that would affect it either. It gives us more time to continue preparation. So we're spending what we can out of our budget to make sure that we're going in the right direction with the facility. I guess trying to knock off any milestones we can before it does. We do get to that, I'd say, state of fruition. With ECU Health, at least we're as far as we can get, so that limits how much they have to do.
Yeah, is a lot of the equipment still there and usable, or did the previous operator take a lot with them when it closed down?
Last time I went through the facility, there was some equipment left, and naturally some of it was on lease that we've given back to the people that were the leasors of the equipment, and there was some equipment still there. So it's kind of a mixed bag right now, but we're not 100% sure how that stuff's going to go either because we're still in the bankruptcy litigation stage of that. So I'm not sure how much longer that's going to last either. But until that is completely finished, then we're not 100% sure.
And outside of the hospital project, what do you see as your goals for Martin County to be able to accomplish economically over the coming years, or do you see potential for success for this area of the state?
Yeah, so I think we can build on our neighboring our neighboring counties. So you look at Pitt County is looking at adding over 3,800 jobs here in the next year or so. I think that obviously should help to provide, maybe not necessarily directly to Martin County, but it gives us that opportunity to possibly house some of these people, provide like housing close to the Pitt County, Martin County line, or in a very accessible location. And it may also allow us to piggyback off of some of those companies, warehousing space, maybe inputs to these processes that are going in Greenville. I think we've got to be creative, and we've got to look at how do we build off of that. I think Martin County stands potential. You've just got to be creative, and you got to be driven to make it happen. I think we can make it happen.
I'm curious, you personally, having made the switch from working on the private sector to taking on this role as county manager this year, what drew you to wanting to take on this type of work in a rural county that's looking for this kind of growth and success?
I think I was driven because I know that I'm capable. I'm born and raised right here in Martin County. I love Martin County, and I'm raising my family here. We've got a nice little farm, just built us a house a couple of years ago. I'm not going anywhere. And the way I look at it, what better way to truly take a position that you have such a strong ownership in. I loved working for the company I left coming here as a project manager when I wound up, and it was I totally enjoyed it. But I never felt like I had as much stake in it as I do in this role here. And I'm pretty motivated I'm not going to say fix Martin County, because I'm not going to say it's broken, but I would like to put it back together in a stronger way than we are currently.
Yeah, so you see potential for population growth. I know that Eastern North Carolina in general has seen, population decline as people move elsewhere for work and that sort of thing. But it seems like you guys may be in a position with the proximity to Greenville to kind of go the other direction.
I think so. We've got a nice business park. We're one of the only counties in Eastern North Carolina to have a railroad spur in our business park. I think that gives us a little bit of a step up on certain areas. And I think if we capitalize on the things that we do have, Martin County can grow. But you're right. Currently, for the last 5 years, we've averaged a little over 100 people leaving Martin County a year. And our neighboring counties are seeing the same.
Yeah, this is an interesting county. You got Williamston, but you got all these little tiny smaller towns around.
It is.
So that pose more of a challenge to sort of try to make sure when you do get prosperity that it sort of lifts all the communities in and around Martin County from one end to the other.
Yes, I've had that conversation multiple times, and I tell people, I live here, and I live just outside of Williamston, so I would consider Williamston being home, and I've got to ensure that I spread the love throughout Martin County, if that makes sense. But if you're going to grow a county, you've got to start at the county seat. The way I look at it, you've got the county governmental centers right here in Williamston. This is the first thing that people see when they come here. This is where they go to get their driver's license. So I think you start and use the mold that you build to try to bring Williamston back, the downtown areas, make it more vibrant, and kind of focus in Martin County and the county seat area, and use that as a way to like a track record to be able to go to these different towns and do the same. It's a trickle-down effect. If you've got a strong economy here in the heart of Martin County, it's gonna spread its way out.
For folks in Raleigh, I think one of the things, whether you're in Martin County or not, if you're going to the coast, you often spend a decent chunk of time driving 64 from one end of the county to the other. Do you see tourism playing a role, if any, given that there is a lot of pass-through traffic that comes through Martin County every day? Yeah,
so 100%. I see tourism as a big part of it. We've got the Bob Martin Ag Center here that attracts quite a few events every year with tons of people that are from outside of Martin County. So we get, a lot of heads in beds from that. And I think we can build on that, and we can definitely capitalize on the tourism aspect here in Martin County. I mean, if we've got beautiful nature, we've got all the good things about Eastern North Carolina, right here in Martin County. So I think if we just really focus on the best way to do so, I think we can capitalize on tourism for sure. Because, like you say, if you're going to get to the coast, at least the northern part of the Outer Banks, you've got to come through Martin County to do it. So,
you mentioned the Ag Center. Are there other sort of tourism draws you see as being something that you can sort of market to folks coming through or stopping in the area?
Yeah, so we've got the Martin County Tourism and Development, the TDA, they pushed the what's called the trails, here in Eastern North Carolina. I'm trying to remember. I hate to say it. I'm trying to remember the name of it right now, but it's a large organization right here that we promote kayaking, and we've got little shelters for people to stay on the river as they kayak down the Roanoke River. We partner with neighboring counties on that, so that helps to have partnerships. So I think if we sell the nature, we've got, we used to have a lot of rock fishing here in North Carolina and in Martin County, where people would come every year during rock season and go fishing. So I think if we can figure out a way to capitalize on those things, then hopefully we can build the economy to a point where we have other draws as well.
Drew Batts is the county manager for Martin County. Thanks so much for taking the time to chat with me.
Yes, sir. Thank you.
Main Street NC is a production of WUNC News. The podcast is edited by Dave DeWitt. You can see photos of Williamston at our website, WUNC.org. And if you're in Martin County, you can listen to WUNC's news and information programming on the radio at 88.9 FM. I'm Colin Campbell. Thanks for listening.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious, because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.